Since 1994, USAID, through the 3 STRAV projects, has supported Kyrgyz partners in comprehensive health system and financing reform, health service delivery improvements, and involving the population and communities in their own health. The long partnership between the U.S. Agency for International Development, the MOH, the entire Kyrgyz health sector, the Kyrgyz people, and many other donors and projects, especially the World Health Organization, World Bank, the Kyrgyz Swiss Project, and UN agencies, has contributed to improving the health of the Kyrgyz population. Elements of the Kyrgyz health reforms are now considered international best practice by development partners. Documented results show improvements in equity, access, efficiency, and quality of health services. The impact of the Kyrgyz health reforms and the USAID STRAV projects extends well beyond the health sector, as health reform has contributed to improved governance, general public finance management reform, and building civil society. USAID and the World Health Organization collaborated to establish a top-down reform process through development of the Manas program and a bottom-up reform process through the Issyk-Kul Oblast Health Reform Pilot. In Issyk-Kul, a completely new primary healthcare sector was formed through the establishment of family group practices. Over time, family group practices were formed nationwide, such that Kyrgyzstan now has a new primary healthcare sector which will continue to develop and improve health services in the 21st century. Free choice of FGP and enrollment campaigns involved the population in their health and changed the nature of the relationship between family group practice doctors and the populations they served. Family medicine was introduced to strengthen cost-effective primary health care, provide comprehensive care to individuals, and serve the entire family. Family medicine is institutionalized and continues to develop. The Family Group Practice Association and Hospital Association were formed to represent health professionals and were delegated functions from the Ministry of Health. The Medical Accreditation Commission established accreditation in Kyrgyzstan. These non-governmental professional associations will contribute to health sector development and improving the quality of health services for years to come. New health information systems were developed and implemented. They served as the building blocks for health financing reform, health service delivery improvement, and the extensive national improvement of health information systems still in process. Issyk-Kul Oblast wasn't just an isolated pilot. With support from USAID and the World Bank projects, the reforms were rolled out nationally and remain part of the foundation of the successful Kyrgyz health reforms. The old health financing system was the source of many of the problems Kyrgyzstan inherited from the former Soviet Union health system. Together, the Ministry of Health, Mandatory Health Insurance Fund, and USAID, in collaboration with the World Health Organization and the World Bank, implemented a step-by-step health financing reform process. The Mandatory Health Insurance Fund was established as a small entity and developed into a mature institution which serves as the single payer leading the most successful health financing reforms in the former Soviet Union. The Ministry of Health has significantly improved health purchasing for public health services, high-tech services, and most recently, TB services. Specific elements of health financing reform include the following: universal coverage through introduction and improvement of the state guaranteed benefit package, additional outpatient drug benefit, and the formal population co-payments. Pooling of healthcare funds first at the oblast, then at the national level, driving increases in equity and financial risk protection. New output-based provider payment systems driving health system efficiency increases. Results documented by the World Health Organization include improvements in access, equity, and efficiency, such as patient financial burden has been reduced, particularly for the poorest 40% of the population. The share of patients making informal payment has significantly reduced for all categories of patient expenditures. Regional distribution of expenditures has become more equal. Financial and geographic access barriers have declined. Utilization of primary health care and hospital care is increasing. Primary care continues to receive an increasing share of the state guaranteed benefits package. Hospitals have increased the share of resources allocated directly to patients, for example, medicines, medical supplies, and food, rather than to the maintenance of infrastructure. Ministry of Health design of Manas Talimi National Health Reform Program, the sector-wide approach, or SWAP, by which all development partners invest and coordinate around Manas Talimi, is the first in any sector in Central Asia. Once again, the Kyrgyz health reforms play a leading role in Central Asian development. Manas Talimi incorporates all elements of the health system such that Kyrgyz health reforms are now fully comprehensive and working to improve the entire health system. USAID is the only development partner supporting all components of Manas Talimi implementation. Over the last 5 years, Strav Plus has provided technical assistance and implementation support in the design and implementation of Manas Talimi. USAID's Strav Plus activities expanded with Manas Talimi over the last 5 years and include the following activities: improving stewardship, especially legal and policy framework, supporting the MOH Press Center, improving and solidifying health financing, including the mandatory health insurance fund capacity and systems, and Ministry of Health purchasing, including CES, TB, and other vertical systems such as oncology and mental health, developing health information systems, supporting health management training, supporting human resource policy and planning, including human resources database, strengthening primary health care and introducing family medicine, including primary health care professional continuing medical education and family medicine residency. In collaboration with other donors, starting the long process of medical education reform, supporting development of the Evidence-Based Medicine Center, promoting evidence-based medicine, and developing new clinical practice guidelines, supporting health facility accreditation, introducing facility-level quality improvement techniques, including those for hypertension and asthma, supporting introduction and expansion of the Safe Motherhood Program and other maternal-child health activities, reproductive health, and family planning activities, supporting bottom-up improvement in CES services, including the development and expansion of the Public Health Coordination Councils, with leadership from the Kyrgyz-Swiss project, supporting the expansion of Community Action for Health and Village Health Committees to Isyk-Kul and Jalalabad oblasts. The big dream of reforming the post-Soviet health system, combined with a step-by-step implementation process, has produced results beyond the imagination of the small group of committed people who started this process. The small group is now a large group of stakeholders with ownership, pride, and commitment to continuing the process of improving health services for the people of Kyrgyzstan. USAID is proud to have been a part of the 15-year Kyrgyz Republic health reform process, which is improving the health and lives of Kyrgyzstan's citizens, and looks forward to supporting Manas Talimi too.